My name is Valerie Wilson, and I'm from Stillwater. I'm the mother of a 4-year-old daughter, Dylan, and I live with my long-term partner, Edward, who recently finished college. I'm one of the many residents of CD6 who are thrilled that we've passed federal health care reform, and angry that Michelle Bachmann did not support this. I've been healthy all my life up until February of this year, when I had an unexpected facial seizure. I was lightheaded, dizzy, and had frequent fainting spells. I had Bell's palsy in the left side of my face for over 2 weeks. I've had a slew of tests done since February to try and diagnose my condition, and the doctors still don't know what's wrong. I've seen at least 2 doctors a week for over 4 weeks. I've had an MRI, a CAT scan, an EEG, and have even been sent to a chiropractor. I'm fortunate enough to have health insurance through my work. But even with this coverage, my illness has been a difficult blow on our family's finances. The co-payments on doctor's visits and prescription drugs have emptied my savings account. My partner lost his job a few weeks before I had the seizure, so we've been trying to get by on one income. We had to pull my 4-year-old out of daycare because we couldn't afford it. If it weren't for my coworkers donating their vacation and sick time to help me, I'm sure we would have lost our house. My family is a good example of how one medical problem can break you, even if you are fortunate enough to have health insurance. We're lucky that I have the insurance I have. We're also lucky that it's me who got sick and not my partner. He graduated last year and got a job at a small IT firm fixing computers. He got laid off a few months ago and has been looking for work. Good news is that he just got a new job at another small IT firm. Yeah. The bad news is that just like this one, the firm is too small to afford health care coverage, and he makes a little too much to afford Minnesota care, so we just go without for him. I'm afraid of what would happen if Edward were the one who got sick. I'm sure that we would have lost our house, ruined our credit, and it would have left us with more debt than we could ever pay off. It would have been very hard on my family. At the end of the day, all I want to know is that my family and I will be able to have health care that we can afford. I want to know that we can get coverage without being denied for a pre-existing condition. And I want to know that my daughter will always have the care that she needs. I'm grateful that Congress passed a federal bill that will make these things happen. The federal health care bill will provide the stability and security that my family needs. And I'm angry that my own member of Congress voted no on this bill. I've contacted Congresswoman Bachmann's office several times over the past year to tell her about my family and about how we need decent health care. I've called, I've written, and I've never heard back from anyone in her office. Once they even hung up on me. Representative Bachmann, it's clear that when you voted no on this bill, you were not listening to people like me, your constituents. I don't know whose interests you were representing, but you weren't representing young families like mine who need decent health care. Thank you.